Hello, my name is Adrianna Rugiero, and I am going to be doing my final for Diversity and Inclusion in HR Management on the University of Michigan's Healthcare System Hospital. So, U of M Medicine's mission and vision. The mission is to advance health to serve Michigan as well as the world, and the vision is our discoveries change care and our care changes lives. For diversity and inclusion at the University of Michigan Hospital, they do a really good job of advertising this on their website, making it very easily accessible to all their patients and users. So we believe delivering the very best care in the world can only be achieved through a culture of respect and the celebration of the diversity of each other. I think that this is a great way to put this in a very short and to the point statement that is easy for their users to understand and feel that this is something put at the forefront of what they're doing. So some statistics about the U of M, as far as employees go, they are somewhat smaller establishment of only 25,000 employees as far as healthcare goes, pretty small. School of Medicine, they're the first school of medicine in the US to own and operate its own hospital. And the charity care, they work to provide more than $469 million in charity care, which is, I think, a great way to involve the community and improve and implement diversity. Growth, it's been named to the nation's honor roll of hospitals. Michigan, they are rated Michigan's #1 hospital with straight A's for patient safety, and patients, they have 1,000 licensed beds. So I think all of these can contribute to inclusion and diversity because it's showing all of these different statistics. But like I had mentioned before about the charity care, I think is a big one, as well as growth and all of that. So for my program, I'm looking to implement and introduce is through something I called Inclusar Insights. At Inclusar Insights, we leverage augmented reality to revolutionize diversity and inclusion. Our mission is to empower organizations with innovative solutions, fostering cultures where diversity fuels success. We're dedicated to shaping a future where inclusion isn't just embraced, but integral to be sustained excellence. So some goal recommendations through research and things that I have looked at with the University of Michigan is something I feel would be great is more women being implemented into leadership roles. When you look at the comparison of men to women ratio at the U of M hospital, there are a pretty even amount of male to female ratio, but not just looking at the quantity, but the quality of position. So bringing more women into leadership, making them more of the face and driving the medical system, I think would be a great way to implement some inclusion and diversity. So making another point that I would like to include is making diversity and inclusion a bigger part of the professional development there. I'm not an employee, so I can't speak 100%, but from the information that I have gathered and the research I have done, making diversity and inclusion something where they can have a seminar or have some more like professional development opportunities where they include diversity and make sure that they're explaining to their staff and whatever level it may be that there is importance in that and that there can be a lot learned for no matter where providers are at. Another point I'd like to recommend for a goal would be to establish more open communication about diversity and inclusion. So to establish more open communication, meaning being open to hearing what different staff members have to say about how they feel that diversity and inclusion is being represented within the hospital. Because let's be honest, a lot of the times the higher ups don't always know how people feel that they're being included or how they feel diversity is being represented around them. Then also the last point I have for a goal would be to encourage the building of supportive relationships. So encourage people to, go out of their way and make a connection and make people feel more included and making people feel like they are heard and that they are recognized. to form those supportive relationships. Okay. So why Michigan Medicine? Why did I choose to look at this corporation? So the University of Michigan Hospital has been consistently been renowned for its exceptional care and esteemed reputation, firmly rooted in its enduring values, which are some things that we looked at earlier on. I do feel that their values are very put at the front of everything that they do. I am pursuing a career in healthcare administration, and my long-standing aspiration has always been to be a part of the U of M legacy, be part of their corporation. So conducting research on their diversity and inclusion programs and their values holds a really big importance to me in moving forward. And the insights that I've gained from this project have already helped and have been very valuable to me, enriching my understanding of the healthcare landscape as a whole as well. So other things that I can look at other systems that maybe I'm working at in the future. So this has been really helpful, and I feel like I'm going to take these even beyond just University of Michigan and the healthcare sector, implementing diversity and inclusion. And that is all I have. So thank you. These are my works cited.